Hi Mama, you're listening to the Mama podcast. It's Sumaya here, the co-founder of Mama Emmy app. Mama Emmy is the first app to exclusively connect mothers across the Middle East, connect with like-minded mamas and create lifelong friendships. At Mama, we are all about connecting mamas to empower women. So let's join together and make this mission a reality. In this week's episode, we are going back to my roots and we are talking all about teeth. So I'm bringing you my last 10 years of knowledge and experience on how to get your children to have nice, white, bright smiles. I've asked my friend Nadia to join me on this one. Let's get stuck right in. Nadia, thank you so much for joining me today because we're talking all about teeth. How long have we been talking about teeth now? We've known each other for about 15 years.
Yeah, 2006. So it's a long time we've been thinking about teeth. It's a small area of the body, but it really takes a lot of thinking.
So if we talk about maybe when to first take a child to the dentist and also at what age they should start brushing their teeth, I think that's important. So the UK guidance is that it should be from really as young as possible and definitely from as soon as the first tooth erupts. So maybe you can give me the insight into what the advice is for the UAE.
Unfortunately, actually, there's no formal advice on these things. So it's very much it's a patient-led system here. And unfortunately, it depends on your dentist as well to give you that information. It's not very publicly known that, people should be taking their kids to the dentist at the young age. They just bring them when there's a problem. So yeah, I definitely reiterate what you've said, to take the children as soon as possible to the dentist. It gets them used to the environment. It makes them comfortable there. They get to see a friendly face. It builds a rapport. But also, definitely, as soon as you see a tooth in that mouth, you need to take them to the dentist so that your dentist can start monitoring their dental health, because it is very important. Even though we have this system in the UK, you'd be surprised how many children actually still have dental problems. So you can imagine where maybe there's not such a strict system. You really, as a parent, have to guide these things and think about these things yourself.
From a mum's perspective, I think the first 6 months are probably the time when you're still getting to know your child and still getting into a routine. And most most babies won't get their first tooth till around the 6-month age. So if you feel like you're still out of sorts and you still can't get to the dentist in those first 6 months, not to worry. But at 6 months, or at least when you first see that tooth, do make that effort to go in and have it checked. And it may be that the dentist can't do much. They probably won't even be able to look into the mouth. But like Nadia's mentioned, it's mainly the fact that you're getting the child used to the environment and, building that relationship with the dentist.
Yeah, it just really helps. It makes them less scared when they're older as well. If you suddenly take them at the age of 4 or 5, they're just going to be like, who is this person in a mask and gloves? It can be a little bit intimidating. So definitely as young as possible. Some mums I've seen here just actually bring their kids along when it's their own appointment and they're just like, can you have a look? Even that's better than nothing.
I absolutely agree. And you'll get personalized advice as well, which is,
so as soon as that tooth appears, brush it.
For sure, as soon as the tooth appears. From my perspective as a mom, you can get a lot of these little gadgets that you can put on your finger that feels a bit like a toothbrush, and you can brush the gums. Really, really great to start with that, because even though the tooth's not there, one, you're dislodging any bacteria that's building up. The milk obviously creates a residue on their gums and their tongue. So yes, they won't have cavities because they don't have teeth, but it really gets them used to somebody cleaning inside their mouth and their mouth being cleaned, and something being inside the mouth. As soon as they can start grasping, which is around the age of 3 months, give them a toothbrush to hold. My daughter would have a toothbrush at the age of 3 months, and she would just play with it. Of course, she's not doing anything with it. She's just chewing on the end.
Yeah.
But that's a great way to get them used to having a toothbrush, brushing their teeth. And it doesn't, ideally, when you're brushing your teeth is the best time to give it to them. So they're modeling. But
yeah. Absolutely.
But as soon as you can, let them play with it. Even if it's in the middle of the day, just give them a toothbrush to play with, and definitely get that thing that goes on your finger. Or you don't necessarily have to have the thing that fits onto the finger. I don't even know what it's called. Do you know what it's called, Nadia?
No, I'm not actually. I don't think it has a formal name, to be honest. They're just like finger toothbrush, aren't they? But yeah,
Yeah, so
just
it's just like a
anything.
silicone
Yeah,
toothbrush that sort of you slide your finger into, so you can put your finger into the mouth, but it's got like very soft silicone type bristle things on the end, or bumps. Some of them have just bumps, so that you're just literally massaging the gums.
it helps when they're
Even if you
teething as well. When they're
exactly,
teething,
so
it can be quite comforting to do that.
yeah, so if like maybe that, or even if you don't want to use that and you don't want to invest in that, just get a children's toothbrush.
Yeah.
It really doesn't matter the type of toothbrush that you should be
I mean, you can
using.
get different children's toothbrushes. A lot of people come in with the really, really soft ones. Personally, I'm not the biggest fan of those. I don't think they actually remove plaque that well. So even for a child, a young child, I would say at least, I would say a medium firmness toothbrush.
So with yeah, so medium or soft. Some of it depends on the brand, very much so depends on the brand, because some brands soft bristle toothbrush is very, very soft. I do like the soft bristle brush because maybe because I'm a slightly heavy-handed. So I know that if I'm brushing my daughter's teeth, I don't want to like traumatize her gums, but at
Yeah,
the same
yeah,
time I still want to be able to clean. So I think it very much depends on the person, and this is something where you'd be able to discuss it with your dentist, because your dentist will be able to see the type of brushing technique and how well you are brushing. So that's where
yeah.
we spoke about earlier about personalized.
As a guide, just to try and help figure out like what sort of brusher you are for yourself, for your kids as well, just take a toothbrush and massage your skin, because your skin over the back of your hand actually has a very similar texture and composition to where your soft tissues are attached to your bone in your mouth. So just massage over there and see how much it's moving. If your skin is actually moving around a lot, then you're probably quite heavy handed, and for you that softer toothbrush is better. If you're finding it's not moving that much, then you could go to a medium one. But as a general rule, if your bristles are splaying a lot, so for example, they look like a little hedgehog by the time you finish brushing your teeth, then yeah, you're definitely heavy handed. So you need to be a little bit more gentle. Just think of it like massaging a sports car. You wouldn't put a wire brush to it. You would, gently massage it. Same thing with your gums and your teeth, because you don't want to rub them away. Once it's gone, it's gone. So just be very gentle.
Yeah, I agree. That's a great analogy. Thanks, Nadia. This is something that we see a lot in the dental practice, where parents will come in with their children's toothbrush and they've either got an adult sized toothbrush or a really large head
Yeah.
toothbrush. And if you now look at a lot of the electric toothbrushes, you'll see that the heads of the toothbrushes are very small. And so even for an adult, the smaller the head, the better, because you can actually get to certain areas much better. So don't think that the bigger toothbrush is going to do better. The smaller
Mm.
toothbrushes or the smaller head toothbrushes are much better in cleaning.
Yeah, definitely. Because just to reiterate, as you said, it just gets to all those areas a lot better. So, for example, you want to get all the way right to the back. So, for those areas, if you've got a very big toothbrush, it's very, very difficult. Another thing that I find actually helps is to not open your mouth too much when you are brushing your child's mouth. So, don't ask them to stretch their mouth open really wide, because all you're doing is flexing all those really tight muscles around their cheek, and they're just getting in your way. Just ask them to open their mouth just enough for you to get your toothbrush in there. You are going to know your child's mouth very well. You will be able to figure out where you need to brush. But the less open that mouth is, the easier it is for you to get into there. They're not going to gag as much. Their tongue and their cheeks aren't going to fight against you as much. So it's just more comfortable for you and your child.
When to brush their teeth: first thing in the morning before breakfast, and if they're
Yeah.
brushing after breakfast, then they need to be waiting at least 20 minutes.
Yeah, all of our food is actually contains certain amount of acid, so it softens the enamel and the dentine of our teeth. So you don't want to be scrubbing onto there. Again, it's the same analogy with the car, right? If you're going to pour acid onto there, it's going to make the car paint more porous. Then you're going to brush on it, even with something soft, it's going to wear away at that paint. So again, same thing with your teeth. You have to give it some time for your saliva to buffer the action of all those harsh acids that are in our food. So it can be easier to brush first thing actually in the morning as well, especially if you're a working mom. It's really hard to, where do you find that extra 20 minutes to wait? We don't all have that time, unless you can find something else to do in that time. Brush the hair or something else, which will take 20 minutes. But yeah, definitely better if you can first thing in the morning. Otherwise, after eating, do wait 20 minutes. Even after drinking something acidic, which we would definitely say is a no-no, but sometimes it happens. So yeah, do wait 20 minutes at least.
And then last thing at night, so there should be no
Mm.
food or drink intake in between brushing and bedtime, and other than water.
Yeah, absolutely.
The one thing that I will point out here is that a lot of children at a very young age will drink milk either to fall asleep, or they'll drink milk very close to falling asleep. And of course, like, looking at this from a realistic perspective, the advice that I started to give after I had my daughter definitely changed, because you really truly understand what a parent has to go through
Absolutely.
to one, get a child to sleep. So, you know, of course, we understand that that's definitely a thing, especially when they're younger. And so it's acceptable. Just make sure you are still brushing twice a day. So brush before milk, if milk is the last thing they're doing before they're falling asleep. But as they get a little bit older, that's something we need to work towards getting them out of that habit. So, slowly try and bring their milk time a little bit forward, so they're not falling asleep drinking milk. It's that pooling of the milk on the teeth over time will start causing cavities. Now, if it's just in the first 6 months, in the first year, then we've got fluoride in the toothpaste, we're brushing regularly, we're going to monitor what we're having during the day so they're not having frequent sugary snacks. The impact that will have long term on their teeth health and cavities is very low, so I wouldn't worry about it as a mom. But at the same time, be aware that, if this continues on for 5, 6, 7 years, then yes, it will start to cause cavities. So be realistic with when we start to get them out of that habit.
Obviously, we're not here to preach, but yes, if at a certain point you can prevent giving milk last thing at night time, and just make sure they just brush their teeth and then nothing to eat or drink apart from water, it is much better in the long run for their teeth.
The way I did it personally was we would give my daughter milk 30 minutes before she was due to sleep, so we would know that she was full. And then obviously she would then brush her teeth before we read the books, and then we'd read books, and then she'd go to bed. So I think that worked for us. But obviously everyone's schedule is slightly different, and it's whatever suits you and whatever works. But just be aware and mindful of how the milk does impact overnight. A lot of children at a young age will also drink milk overnight as well. So babies will drink milk overnight. So of course this is something they'll grow out of anyway, and I'm sure most moms will be working towards getting the child to stop drinking milk in the night, because that means they have to wake up too. But if it's happening for a very long time in their childhood, then again that can have an impact also.
That is a short-term issue, but it is better to try and avoid it becoming something that is a little bit more long-term, just for your own ease as well.
When or how to get a child to brush is usually the question we get asked the most in dental practice, and I'm sure, Nadia, you've probably got the same question too.
Yeah, it's not something that is fun. It's just something that we have to do. And especially because you have to do it every day, they're like, oh, but I did it yesterday. So obviously it does help, like you said, when they're modeling you, if you're doing it as well, make it into a fun activity. That's what I always used to tell my patients. Put on your favorite song. If you think about the average length of a song, right? It's about 3 minutes. Brush to your favorite song. You can both stand there and hum along, right? And you can just brush your teeth. Make an activity out of it so that it's a bonding experience for both of you. You're interacting and they're copying you as well. You can get fun little egg timers which help with the time. But I prefer the singing along aspect of it, because it makes it into something fun, makes it into something enjoyable. Gimmicks can help as well, with kids. Electric toothbrushes with these flashing lights and all of that, or with their favorite characters on them, Paw Patrol or whatever it is. These things actually really help with children, and it just gets them into doing something which is unfortunately a boring everyday chore. But if you can bring some sort of activity into it, it really helps. Please, if possible, do try and observe their toothbrushing till around the age of 7. We would definitely advise that parents should, if they're not actively doing it themselves, which I would advise that you try if you can, but otherwise at least observe what they're doing till the age of 7, because you really want to make sure that those initial baby teeth that will later on fall out and then they'll be replaced by the adult teeth, you want to make sure that they have a good foundation, because our baby teeth guide the adult teeth into the right place. They act as a path. So you want to protect both. Both are important. It's not just that our adult teeth are more important. They're both important. So yeah, make it into a fun activity. Sing along, have a little dance. just make it fun.
Yeah, I totally agree with that. So the activities really help. There's also some apps that you can get. So Oral-B have released an app which has a 2-minute timer, and as you brush. So the idea is as you brush, the puzzle becomes exposed. So it's a new picture every day. So the child gets to see the picture becoming exposed. The biggest thing that I can say from the perspective of being a dentist and a mom is that modeling has the biggest impact. So I find that sometimes my daughter will say, nope, I don't want to brush, but if she sees me brushing, then she'll want to brush because she sees me doing it. So that does have a huge impact. Another thing that does help is starting them at a young age. So the younger you start brushing, the more it will become part of routine and the norm. So it's something they expect to do every day. If this means that, you know, you've got a slightly older child and you didn't introduce it at a younger age, just the things that Nadia mentioned really do help. So having a song to sing along to whilst you're doing it, and let the child choose the song, you know, let them choose which song it will be on that day. Things like that can really help. But like you say, it's just making it fun.
The flavor of toothpaste can help, because adult toothpaste for a child, that can be really offensive, right? The minty taste, even sometimes we find them too strong. So you can get toothpaste which have a very mild taste. So I think there's a toothpaste available. It should be available on Amazon AE or Noon. It's called Nursaid. So it has a really, really mild taste. It has the correct amount of fluoride as well, but it's a really gentle, mild toothpaste. The flavor is not too offensive. And then, you know, if they want to copy you, you can slowly start introducing your toothpaste for them to get the flavor as well. But having a nice tasting toothpaste help as well. And I think that brings us nicely onto actually fluoride toothpaste, right?
Fluoride is incredibly important for your teeth.
Yeah, absolutely. I mean, for a child of less than 3 years old, you want a smear of toothpaste. Now, when we say a smear, we literally mean like along the center of that small toothbrush head, just a smear of toothpaste. It's a very thin layer. When they're a bit older, 3 to 6 year olds, then you want a pea-sized blob. So an average pea, we're not talking about big fat, you know, marrow peas. We're talking about a small garden pea. So it's a very small amount. And actually out here in the UAE, the water is not fluoridated. In the UK, we actually, in some areas, we have fluoridated water. So even with that, we find that children still have problem with their teeth. So out here, you don't have fluoridated water. So the amount of fluoride that should be in the toothpaste. So just as a rule of thumb, it's just easy. I mean, you can check on the back of your toothpaste tube that will tell you how much fluoride is in it. Now, there can be different types of fluoride, so sometimes they can split that amount over 2 or 3 ingredients. But when you combine that figure, try to make sure it contains approximately 1,350 parts per million of fluoride up to 1,500 parts per million of fluoride. So on average, it's generally 1,450, but try and make sure it's within that region. And you have to be a little bit careful sometimes with children's toothpaste. I've seen some which actually don't have enough fluoride. So do be aware of that. Massive side effects at all.
So what I generally say is, as soon as you start using toothpaste, use adult toothpaste and use a smear. And that way you know that they're getting the right amount of fluoride. Like Nadia mentioned earlier, you can get toothpaste that aren't as strong in terms of their minty taste. The other downside to using a children's toothpaste is that they get used to this very mild or flavor, so they're fruit flavors. And the problem with that is then they get to the age of 6 or 7 when they need to start moving to an adult toothpaste, and they really struggle with the taste because they haven't used it for 6 or 7 years. So I think it's actually better just to start them very early from an adult toothpaste. And another thing to just point out is, if you do not want to use fluoride, then that is a personal choice. Of course, when you're going to see your dentist will have the discussion with you about this. But if you choose not to, then it's even more important that you see your dentist regularly, because those early signs of cavities and decay needs to be picked up before it becomes a huge problem.
Yes, and like you said, if you're against fluoride, then do let your dentist be aware of these things as well, because sometimes offer to put fluoride varnish on your child's teeth, or sealants which also contain fluoride. So it's important for them to know what are your preferences and things as well.
Now, cavities form not just because we don't brush our teeth, but cavities can form because of the types of foods that we eat as well. Now, everybody thinks of sugar as sweets and chocolates, but there are so many foods that actually have sugar in them or have a form of sugar that can impact your teeth in a negative way. And this is what we call hidden sugars.
Yeah, I mean, they're in everything, right? Actually, there's there's sugar in all our foods. So it's not only how many times a day you're eating, it's what you're eating as well. They make a really big difference. And the thing that is most surprising to parents is fruit, actually. So fruit has a lot of sugar in, and especially dried fruit. So we often, and I'm sure you'll have seen this, Amaya, that children walk in with a little packet of raisins in their hand or something like that, and they're massively sticky, aren't they? Not only do they stick to your children's teeth, so you've got a lot more sugars available for those bacteria to be eating on, but also it's just packed full of sugar, and you don't realize it's quite a harmful food. So it's much better to have with your main meal, straight after or before your main meal, right?
Yeah, so fruit is definitely one of the biggest ones because, of course, fruits and vegetables are good for you. And so people and parents opt to give their children fruit as a snack. But being high in sugar, it can really impact your teeth. So like you said, try and give them at meal times instead of in between meals. And then to try and limit the sugary foods between meals. So we're trying to stick to sugar-free or things that are very low in sugar or less available sugar for your teeth in between meals. So this can get quite complicated in terms of the biology and how it all works, but all types of food will have some level of sugar. Now, whether that's a sugar that's available to your teeth to digest and form into a cavity, or that other forms of sugar, which is where it gets into your tummy and then is digested. Ideally, you want to be giving them foods where the food is actually being digested in the tummy and not necessarily on their teeth, and that will limit the chances that they will get cavities. So some examples of this type of food is nuts, cheese, yogurt, milk.
Avocados. It's like an easy snack, carrot and hummus. Cucumber and hummus sticks.
Cucumber and hummus sticks is another good one. Generally, the thing to think of is if the food is high in fat, generally it's low in sugar. That's a very general rule, but that's generally what you'll find. The other thing to be aware of is crisps are sugary. They add sugar to crisps, a lot of crisps. They're now very you can find some brands that are actually child friendly. Read the back of the pack, make sure they're not adding sugar to the pack. If you look at a general sort of adult crisp packet, or chips, if you want to use the American term, it will have sugar added. There's a lot of hidden sugar in a lot of foods where we would expect it not to have sugar. If you actually read the pack, there will be sugar added to those foods. Now, we're not saying don't give your children snacks. Of course, children need snacks. They survive off eating little and often. So it's your 3 main meals plus one other sugary snack a day. So you may still use fruit as a sugary snack. So you might have your breakfast, a fruit snack in the middle of the morning, and then your lunch. Then one other snack in the afternoon might be cheese or yogurt. And then in the evening, your dinner. And ideally, that would be the ideal spread of meals for a child. And that would range from like as soon as they start eating up until sort of adult, really. We say 4 sugary attacks a day.
Yeah, I mean, exactly. It's not only what you're eating. So as you said, pretty much everything has got a certain amount of sugar, but obviously we cannot stop eating or drinking. That would be completely opposite, unhealthy as well. But we can limit what we're eating and the number of times a day. So for example, if you do want to have something extra, a little bit sweet, and maybe you don't want to give it to your child at snack time, give it just before or after the main meal, because then it's not as harmful to your teeth. You're already actually eating your main meal, so that slightly different sugar at that point is not as harmful. We obviously wouldn't we wouldn't advise this at every meal time, but once in a while there's nothing wrong in that, because obviously you do need to have variation in the diet. It is good to have lots of different things in the diet, and it makes it easier for yourself and the child. But yes, try and limit it to the 5 times a day. And drinks as well, do be careful of drinks, sort of squash, juices, carbonated drinks. You really want to avoid anything like this. I would advise sort of even till the child is 6 years old, avoid these things. If you can keep it to milk and water, it would be much better, because these actually have a lot of added sugar.
Yeah. Something to point out there. So natural fruit juice. So if it's a blend of fruits that have just been cold pressed, that's still got sugar. The sugars are released as soon as the fruit is blended. So even if they haven't added sugar, there is still sugar in that drink. The other thing to add is a lot of marketing on fruit juices for children says no added sugar. That literally means that they haven't added any sugar to it. That doesn't mean there's no sugar in the actual item itself. So there will be some naturally occurring sugars in those as well. So I agree with you there. So try and limit them to meal times only. So I would say water only between meals, or milk if the child is still drinking milk. And if you're going to give them juice, or you want them to have a juice, then at meal times is the best time for them to have it. Now, most people think that dentists are really against sugar and snacks and dessert and cakes. Look, there's a time and place, and as a parent, you decide whether you want your child to have those things or not. We're not here to say don't give them those things. We're just saying just choose the right times to give those things. So give it after their meals. Don't wait 30, 40 minutes, an hour after their meal. Let them have it straight after their meal as a dessert. That's going to do less damage to their teeth than if you let them have like cakes as snacks or sweets as snacks. So we're not here to preach and say don't give them sugar at all. That's a personal choice as a parent. Whether your child eats sugar or not is up to you. But just having them at certain times in the day will definitely cause less damage to their teeth than if they were snacking on these things throughout the day.
Yes, and I mean, if you're going to give juice, which think carefully about it, juice or smoothies, try and limit to your portion to about should be 150 mils is about one portion. Try to limit that to just once a day. And the other thing that just popped into my head while we're talking about sugars, sugar-free medicines. If your child is on any medication, please ask your doctor or dentist to prescribe the sugar-free version, because they generally are available. So a sugar-free version is massively helpful.
Great job for remembering that, Nadia, because Calpol and Nurofen are like two things that we use quite frequently, especially when the children are teething or when they're unwell, especially when they're young, because they get sick quite a lot.
It reminded me of honey as well. Honey, obviously, it's good for your health and things like that. But again, try and keep it to the main meals, and don't necessarily. Sometimes we see kids who would come into clinics with the dummy in the mouth, or the pacifier, as it's sometimes also called. You'd see people dipping it into honey. So just be careful of that, because it's, again, very, very sticky, and it has a lot of sugar. Yes, it's a natural sugar. Do be careful of that. Try and keep it with the main meals if they're going to have it.
Yeah, just one thing to point out there. So a child is under 1, honey is not recommended anyway, because it can cause botulism. So we are going on quite a long time with teeth, and you can see that, there's a lot more to looking after teeth than you may have first imagined. We're just going to end this briefly with beakers, cups, bottles, and dummies as a brief overview. This is probably and actually is a topic in itself, so we won't go into too much detail, and we'll probably cover this as a separate podcast in itself. But just to give you an overview, the advice is that a dummy and a bottle, so anything that has a sucking motion, should be stopped by the age of 1. Now, this is the advice. I know it's way more difficult in practice than it is in theory, but that's the advice. And so it's good to know what the gold standard should be. And so you can make that decision of whether, it just should, hopefully will encourage you to move away from that sooner rather than later. And I'm sure Nadia will explain why in a second. Having more experience in orthodontics, she'll be able to tell you more detail as to why.
When your child is sucking from the pacifier, the dummy bottle, it creates a suction motion, right? And that can obviously, as your child is growing, their facial structure is forming, their jaw bones, both top and bottom, which are two separate entities, they're forming. So it can almost force your bone and your teeth to go in a certain direction, which means afterwards it can lead to complications, and possibly they might need to wear braces. Sometimes you can get slightly more severe cases which require slightly more invasive treatments. So if possible, it's better to avoid these things. I mean, I would say that after 6 months, try, if your child is using a bottle after 6 months, try to move over to a free flowing cup. It's much better. And definitely, like you said, discourage bottle feeding from 12 months onwards. It's quite important, because we're really forming at that stage. You want to prevent problems later as well. I know it can be a lot easier at this stage to just go with it, but honestly, the problems that you can face afterwards are much more severe and significant. So if you can just avoid it in the first place, it's much easier.
Yeah, that's the same with thumb sucking as well. So that can have a similar impact. It's much more difficult to get a child to stop thumb sucking. And we find that often children will be at a much older age before they can stop doing that. Now, I know some babies just start thumb sucking without us sort of, it's not an intervention by the parent. Usually it's often something that the child does to self-settle. So if that happens, speak to your dentist. They'll give you advice as to how to sort of discourage that habit, and maybe help support you in trying to stop that habit. There are things that you can buy on the market that will help. But again, that's very sort of specific to the individual, and it's best to discuss that with the dentist or with your regular dentist. Another thing I'd like to point out is we're not saying that you can't give your child milk. It's the fact that you'd be using a bottle to give them a milk.
Yes.
So it's the sucking motion that
Yes.
causes the problem. We're not really talking about milk here. And so
Yeah.
with if they are drinking from a bottle itself and not breastfeeding, so if they're drinking from a bottle, then you can buy these sort of transition bottles. So the company NUK does a good transition bottle. So it's been designed so that it transitions them away from the sucking motion into a free-flowing cup. Now, often what we find is children are very good at drinking things like water from a free-flowing beaker or cup, but then they really struggle to drink milk from those kinds of things, just because I guess they've created an affinity to a bottle, or they've associated the sucking motion, milk, with the sucking motion. So it is more difficult in theory, in practice, than in theory. So I do sort of understand where parents will be struggling with this. There's not much in terms of what we can do other than just try and encourage the change in habits. And the sooner or the earlier you can do it, the quicker your child will actually transition into the new habit, because the longer they've been doing it, the harder it will be for them to transition out of. That also just finally reminds me of the fact that water should be from, so you can get beakers which are free flowing, which means that if you tip the beaker upside down, the water should just fall out. That's what you want. Anything that stops the water from flowing out, so these non-spill beakers that you can buy, non-spill cups, are generally not free flowing. So that will mean that your child will have to suck to drink. And again, long-term use of a sucking motion can impact. And also you just want them to get used to a free-flowing cup, because the quicker they get used to drinking from a cup, the easier it will be for you as well.
Yeah, absolutely. I think that's pretty much everything. I've just got...
Yeah, totally. I think we didn't really touch on teething so much. And I think it may be good just to run over that for a few minutes before you need to dash off.
Yeah, I mean, that's you'll have experience as a mum regarding this. My experience is more from sort of a dental point of view, but obviously it can be quite uncomfortable for the children. You see them come into the clinic and they've got their little red cheeks and they're salivating, not sleeping as well. So that can be quite uncomfortable. But any sort of, I do actually see a lot of people at that point rubbing honey and things over their children's gums, because that taste it's also a distraction. You can get special sort of toys and things like that, which they can have a little chew on, that just helps sort of, it's like pressing onto a bruise really. Sometimes it can ease that discomfort in the short term. And I think it goes along the same sort of psychology. When they apply pressure to that area, it can just give a little bit of momentary relief. You can get medicated things as well that you can apply on there, which some people, I suppose, have found helpful. But again, try and find a sugar-free alternative. Did you find with your daughter as well that any of those actually helped?
So what my experience with seeing children in clinic, and then obviously friends that have had children as well, is that it does really vary from child to child as to how much discomfort they will feel with teething. So some children will go through teething and not have any, or the parents will not notice, they won't notice much at all. And then other parents will have a lot of discomfort, or their child will have a lot of discomfort with teething. And my daughter was on definitely the other end, where she had quite a lot of discomfort with it. So the teething powders help. It is very temporary. So what I found really helped was using the teething powders just before meal times. So it soothes the gums a little bit, and it just helps with feeding. So often children will go off food when they're teething, and it's quite common for them not to eat very well when they're teething. That's very, very common in children. It happens when they're sick as well, or when they're going to become sick. So sometimes you might have a couple of days of them not eating well and you just don't know why. It's often because they're either going to the teething, or something in terms of a bug might be coming up. And so teething powders really helped just before meals. The other thing was, on the days that there was quite a lot of discomfort, Calpol, Nurofen, definitely for us. Some children don't need it, but really the painkiller was required for us. So we tried not to give it too often, and this was more from a personal perspective. We generally used to give it just before bed, so she was a bit more comfortable when she was going to sleep. But again, if you need to use it during the day, I guess that's up to you whether you want to use it. Carrot sticks or carrots are great for chewing on, because they're quite hard, and again it can massage the gums. Some children like the teething toys, other children don't, so it's a case of just trying them. We tried about 15-20 teething toys. She didn't like any of them.
Gosh.
The other thing that really helps is ice lollies, and I don't mean the ice lollies that you can buy from the supermarket. I mean making your own at home. So just freeze some ice.
Yogurt as well. Sometimes that helps. I've seen. Yeah,
freeze some yogurt, freeze some milk as well as an alternative. So anything that's like sort of frozen, but good for your baby, will be great for their gums, because it will just massage and cool the gums. So it just has that cooling effect, which will help as well. So all of those things are things that you can try. The last thing that comes to mind is you can buy Ambisol, and Ambisol is a topical local anesthetic. It is really good for numbing the gums, but be aware that it is a local anesthetic. So you're applying an anesthetic to their gums, so it will numb their gums and it will settle the pain. It's short term in that it will last about 30 to 40 minutes, but it is a local anesthetic. So use it sparingly and use it only when and if required.
And if you want to obviously get advice from your dentist on how to apply it, where to apply it, that can sometimes be helpful as well. You could take it along to the dentist, and they could actually apply it once, so that you can see, because like you said, you don't want to be applying too much of that. They will be licking it off as well, so they're going to have a bit of a numb tongue for a little while.
Yeah, totally. So, Nadia, not the most exciting topic to talk about, I'm sure you'll agree.
But important,
I hope it's very important, and I hope it's been useful for the listeners, and I hope it can really help and encourage them to make some changes, or just to make changes and just to help guide them a little. Don't forget to share our episode if you think it's going to help one of your other mama friends. And if you share it on Instagram, don't forget to tag us at My Mama App.